Hey everybody, welcome back to Around the Emirates podcast with Sara Mousa, where I speak to guests from across the UAE about topics you want to hear about. Today, I am honored to be joined by the incredible Dr. Mufaza Rashid. Hi, Dr. Mufaza.
Hello, and thank you so much for having me on your show.
Thank you so much for being here. I am so excited to talk to Dr. Mufaza about her experience as a family doctor. She is so well known in her industry. Please, Dr. Mufaza, tell me your story and what got you started.
Right. So it's a bit of a long story, but I'll cut it short. I started off being a medical student in Pakistan, and I qualified in 2001, and later life took me to the UK. And then I spent the next 17 years of my life there being a doctor. And I qualified as a family medicine consultant in 2011. And in the UK, you call them general practitioners, but it is a training program that you finish, you do exams, and it is quite a journey that you have to do a certain number of years in hospital and out in the community. So I chose to be a general practitioner or a family medicine consultant because number one, I was interested in like all sort of specialties and working with people. So I think that was the best opportunity where you can engage with patients on one-to-one basis. You really get to know your patients. You get to know their life because it is very relevant to what health problems they have. So the impact that you can make, because as a specialist, which is obviously an extremely important job, but you can be very specific and you can work on a particular symptom or a particular problem and help solve that. Whereas in our field, we have to get to know the patient as a whole, because that really impacts on how you manage them. And along the way, you make strong patient relationships, and that's very rewarding to see if you have positive outcomes, and you feel that the difference you're making, feel it progress through different aspects of the patient's life. So I think that really appealed to me. And my keen interest in preventive medicine and lifestyle medicine, which you may have heard more recently, I think it's more talked about in the recent years, but it has always been there because we always work with the preventive side of things, and kind of health education, and monitoring disease progress and guiding patients through that process and what changes they can make to their lives to help improve outcomes. So that all kind of fits in with that specialty very nicely.
It is so cool that you've been able to like bring your expertise kind of from the UK, obviously specializing as well in Pakistan and now here. What kind of challenges have come with your kind of cross-cultural or cross-barrier experience, and how have you overcome those?
Yeah, I mean, obviously, it comes with, as you have these personal as well as professional challenges every time you move countries, and I've moved countries about 4 times in my life, so it's a different continent. So it has, obviously, I would take that challenge as a privilege as well, because obviously each challenge helps you grow, helps you learn, but obviously not always easy. So the biggest challenge was obviously leaving the home country, coming to the UK, and then life change with getting married, having children, all that. So, and then the challenge was to then pursuing career as well as having the work-life balance. So in the UK, I must say it's a great health system. It's a national health system which is free for all at the point of care. And although obviously people hear about things being not being as great at the moment because of obviously cost issues and all that, but it's a great system, still free for emergencies, free healthcare for everyone. So that obviously it's a privilege being part of that health system. So coming to back to the training process, you have to choose to apply to whichever specialty you need. And when the time came and I had a young child, there was option to actually go part time, which again is unique to the UK health system, that they do allow people to work part time. And that's one of the reasons that I was able to work as well as raise a child with relative kind of help, when you don't have any immediate family, or you cannot, you're not happy leaving your child in childcare the whole time. So I think that made it quite easy for me to continue the profession as well. So although it took me longer to train, but obviously, the outcome was that I could both be a mother and work and have a career as well. So I didn't have to choose between one or the other. So I'm a kind of big supporter of supporting women through work, and if that kind of thing can help women progress their careers as well as be useful, and obviously be independent, as well as not compromising family. So that's how obviously such a positive thing that come out of that system. So
I
I'm
love
forever
that. I love
grateful.
that.
for them to allowing me to do that.
That is amazing. It's great that we can talk about kind of empowering women across different sectors, especially healthcare. Like healthcare, obviously, doctors have very high expectations of their, difficult work schedules, and they have to take very long shifts. And of course, as a family doctor as well, I mean, I would imagine you cater to so many different ages and so many different types of maladies as well.
Yeah, yeah, absolutely. So it's a quite a challenging job, even though which it a lot of people have the perception that if you have a cough or a cold, you go to your family doctor, which you do, but along the way we are looking at, as I said, the person as a whole. A person who is coming to you with a cough may actually have a much deeper problem. They may have mental health issues. So it's very important for to pick up those cues and then focus on that and encouraging people to talk about it. You have limited time, especially in the UK, you have 10 minutes to work with, but then we see people coming in with emergencies, with people who need to go and be admitted in hospital. We pick up children in distress. We pick up all sorts of things. So it's quite a challenging. If you're looking at 40 patients through your day, then you're picking up a lot of stuff, and also background work and work that needs to be done afterwards and followed up. So it's a constant kind of a mental minefield.
Well, first, I want to say thank you to for you doing all of that for the community, just sitting, having 10 minutes per patient, 40 patients a day, and then going home and then being a mom after. I applaud you for being able to do all that and still have the energy to come on and do a podcast on your Sunday night. Um,
Yeah.
but
So I moved to the UAE in 2017. Obviously, the healthcare system is different here.
mhm.
Which, if you're working as a family medicine consultant, you have a lot longer, because obviously it's an insurance-based system, and you are much more kind of relaxed in how you book your patients. So I was affiliated with two practices, and I worked with them for like 3 years, and then I got involved with school health in the with one of the schools, and that led me to getting a job at one of the other schools as being full-time school physician. So that's what I do currently in the UAE, and that allows me time to actually then go back and keep my license in the UK, so I can keep both. So that gives me that balance to juggle the two licenses and do what's necessary to keep them both.
That is very cool. And I'm actually curious now, since you've talked so much about how you've been able to juggle everything. Is there a kind of like milestone moment or experience that you've gone through that you want to share with the listeners?
Yeah, it's a constant, like it's not just one moment, it's a constant juggle, because for me to be able to prove that I'm still a working general practitioner in the UK, I have to fulfill lots of criteria, and the General Medical Council, which I'm registered with actively, is and have a license. It has got certain criteria that you have to fulfill per year, and you have to have your annual appraisal, and you speak to your appraiser, and you talk about whatever you've done through the year. But because general practice is quite unique in the UK, how it exists, with how we work as doctors, with how the primary care system works there. So any of the thing I do talk about my experience in the UAE, but I have everything that has to be done within the UK as well. So that obviously poses a challenge in terms of achieving all of that. But they have been very positive in terms of counting what I do here as well, because I do work with the UK school, which doesn't even matter if it's UK or not, but working with children, which again, that side of thing is quite unique what I do. And I have a lot of respect for the school health section in the UAE here, which is miles ahead of what happens in anywhere else in the world, where people just know about having a school nurse who does the very basic, obviously stretched out, all that. But over here, there's such a well structured healthcare system within the schools that pick up children. We're seeing children with chronic conditions. We're looking after their conditions in school. We're picking up problems. We're guiding patients, parents in the right direction with how to, deal with their children in terms of behavior, in terms of mental health, their physical conditions. We are storing their medication in school. We're doing immunizations in school. So there's so much that can be done, and because the children are spending such a long time they do spend a large proportion of their lives in school. Having that healthcare presence is very reassuring to parents, to the school administration, because so much happens in school. Kids have accidents, kids have emotional issues. So it's just like having that presence of adequate number of nurses and a physician on site. Is I think is a very unique idea, and UAE does it really well.
You've given me an idea now to ask you a different question that I've never asked on the
Yeah.
podcast before. If there were kind of the top two or three maladies or illnesses or conditions that you wanted to raise awareness about the most right now, what would they be?
Oh, yes, that's tricky. I think the one of the growing number of like obviously the growing problem seems to be obesity, although we hear a lot about it and a lot of people are not as aware of it as a growing epidemic, and a lot of people still kind of think of it as a lifestyle choice, which it is lifestyle related to a very big extent. But as we know, we have as population changed, and over the last 40, 50 years, we've changed our epigenetics to a level where this is become a disease process and people need active help. So especially in affluent countries where food is not an issue, then it comes with the problem of obesity. So I think raising awareness. So this is what we do very actively in school as well, and we are meant to, according to the Department of Health as well, that we raise awareness around for nutrition, having regular workshops with kids. We are checking their BMIs, and we are raising concerns if there's a problem. So a lot needs to be done, and people need to recognize it as a condition that needs to be actively managed rather than blaming it on the person, particularly if it's a child, because it has a lot of factors involved. And the number two, we need to raise awareness about mental health. So mental health is the next biggest explosion that we're seeing, and it's again there is awareness now more than because of social media and all that, but may not all be the right information. So people need to be able to recognize themselves, their children, the family around them. If anyone is suffering from any mental health issues, then they need to know what to do and not attach any stigmas to it if they which does happen in a lot of cultures still, where people don't ask for help, and it is suffering. And the third thing I would point out is the importance of screening, because in the Western country, in the UK, there are very well established screening programs. The patients will send reminders and everything. Over here, because it's all insurance based and you may be in different systems, so you need to take responsibility for yourself and just make sure that you speak to your doctor, your family medicine doctor, knowing, see, I'm wearing this today as well because it's the breast cancer month. So looking out for your mothers, your grandmothers, and reminding everyone that they go have their screening and ask your doctor if you do anything.
I love that. Thank you very, very much, Doctor, for sharing those specific awareness stories. I think it's really important that a expert such as yourself is the person that we need to listen to, right? Like we can read things online, we can chat GPT questions, but to hear from you, from the person that has studied this for years and has such important international expertise, that's where the real information and source of knowledge comes from. And I'm curious, do you have any word of advice for listeners, anything at all that you want them to listen to today?
Yeah, I think general advice would be to always keep learning because the world's changing, and always be open to learning, and and always be able to share. Always share your experiences, speak to your friends. I think the conversation should be about what you've learned, and sharing any new piece of knowledge, and make that a habit amongst your family, amongst your children, that you're sharing new facts and new learning every weekend, or every whenever you're sitting down. The other thing I would say is diversify. Like if you are in a profession, I know not all professions, because some can be very consuming, medicine being one of them, and a lot of others as well. But diversifying, like trying something new, like if you have a portfolio career, that really helps. So if you are kind of able to do within your profession a few different things, that always helps as well. So that's what I tried to do as well. So I tried a few different things. I got involved with a charity project as well, which I kind of aligned with my school health program. So me and my husband are part of this charity for over 20 years, which who are doing a great job in North Pakistan. They've got a hospital. So we've been part of that group. But in the last couple of years, I had this idea that if based on the same school health guidelines, we have some orphanages in that catchment of that hospital, and we apply the same guidelines to them and have a health visitor go in and check on those kids and do some basic stuff around nutrition and everything. So that is kind of grown, and there's lots of ideas and lots of, things to come out of that as well. So just thinking laterally, having a very serious hobby, I think just whether it's reading, whether it's anything, just do so, have something of your own. And if you have the means, then travel. And it doesn't have to be fancy holidays, but have the opportunity to travel and go and see how other people live. And that really helps you grow.
Wow. I am not always lost at a loss for words, but with you, I genuinely am so inspired by everything you just said, Dr. Mufaza. Thank you so much for sharing your story, and just the humanity that you show, the passion you show for people and for the community is outstanding. And I'm so grateful that I had the chance to hear your story today. Thank you so much.
Oh, thank you so much for having me. Thank
Of
you.
course.
Have
Thank
a
you.
good evening. Yeah, thanks. Bye-bye. Bye.